Okay, so we've spoken about this already. Tumor metastases, only in malignant tumors, right? And it's the spread of cancerous cells from the primary location to other sites around the body. So the cells break away from the primary cancer, and they form new cancerous growth in other parts of the body. Okay, metastatic cancers are invariably much more difficult to treat, right? They can't be removed with surgery any longer, for example, because the cancer has spread elsewhere. So typically it's a combination of chemotherapy and radiation therapy to treat metastatic cancers. So how do they spread? Well, we had an image of that either through the lymphatic system that then drains to the closest lymph nodes. So for example, if you have breast cancer, it'll drain to the lymph nodes under your arm, so in your axilla, or the cancer can spread through the bloodstream and travel to other areas in the body. Okay, so metastatic cancer typically has a significantly lower survival rate compared to a cancer that hasn't spread yet. Okay, and we'll get into a bit more detail about that when we talk about staging of a cancer, meaning how far has it spread. Okay, so here's an image explaining metastases to you. So in this image on the left, you have primary colon cancer, and colon cancer often spreads to the liver. Why does it go to the liver? Well, the bloodstream from the entire digestive tract drains to the liver through the portal vein, right? And after it goes through the portal vein, it goes through the right side of the heart to the lungs. So colon cancer also spreads to the lungs, right? So it has liver metastases and lung metastases. On the right, it's showing you the primary cancer at the bottom there and how it will get into the lymphatics. So the cancer has spread into the lymphatics and has also spread into the bloodstream so that it can set up new sites of cancerous cells elsewhere. So when we think of tumor metastases, we can think of local seeding into adjacent tissues. So say for example, this is the inside of a bladder. Okay, so there's a tumor, a malignant tumor growing inside the bladder itself. Okay, well, it can penetrate through the bladder wall, so and leave the bladder and then invade local adjacent tissues. So that's local seeding, or it can penetrate and get into the lymphatic system and into the bloodstream and go elsewhere in the body. So whenever there's a diagnosis of cancer in a patient, the details are required, such as how far has the cancer spread. So, and that's called staging of a cancer. Okay, so we want to know at what stage has this cancer been diagnosed. Is it in a very early stage where it's just, for example, on the wall of the cancer, or has it gone through the muscle of the bladder? Has it spread through the muscle of the bladder to the adjacent tissue? Has it spread into the lymphatics and now lymph nodes in the area have cancer in them? Or has it, or even more spread, has it metastasized to other parts of the body? Okay, and that's what's called staging of a cancer. And we'll have a slide on that. So we won't spend too much time on this slide because I've already spoken about it. So primary cancers, so where the cancer originated from, has preferential metastatic sites in the body. And I've given you examples of that, but here's another one. So the primary site being, say, lung cancer, and with mets to the brain, so metastases to the brain. Okay, so we would say metastatic lung cancer with mets to the brain, or metastatic lung cancer with mets to the liver, wherever they've metastasized to. Okay, prostate cancer, I gave you that example, how it can spread to bones and lungs. Lung cancer likes to go typically to bone, liver, brain, and also the adrenal glands, by the way. And colon cancer likes to go to the liver and lungs. Okay, so very common metastatic sites for primary cancers are lungs, liver, brain, and bone. Those are very common in many primary cancers. Okay, so what's grading and staging of a cancer? So grading of a cancer is done with a microscope. So the tissue is taken, so a sample of the cancer is taken, and it is looked at under a microscope, and a grade is decided on the cancer. And really what the grade of the cancer is doing is how well differentiated or poorly differentiated is this cancer. If it's well differentiated, it means that it's very similar to the cells around it, and it's probably not that aggressive. If it's very poorly differentiated or anaplastic, and it looks nothing like the cells around it, then it's poorly differentiated and likely very aggressive. Okay, so that's the grading. The staging of a cancer gives us information about how far has the cancer spread. And that usually involves doing an assortment of tests, such as CAT scans or ultrasounds, to see where the cancer has spread to. Right? So stage 1 of a cancer is usually just local and confined to the tissue of its origin. So a stage 1 lung cancer is a lung cancer that's just confined to where it started. Stage 2 has invasion into adjacent tissue. Stage 3 is now involving lymph nodes in the area, and stage 4 is distant organ metastases. Okay, so staging is really telling us how far has this cancer spread. And there's a system used called the TNM system. So T meaning what's the size of this tumor and how has it spread locally. N meaning lymph nodes, or standing for lymph nodes. So how many lymph nodes are involved. And M standing for metastases. So a very quick system that we use is the TNM system. Tumor size, are there lymph nodes involved? Is there distant metastases? Okay, and the tumor size is graded or is numbered 1 to 4. Lymph nodes 0 to 3, and metastases is a 0 or 1. 0 being there's no metastases. Okay, so we don't need much time on this slide. So staging, what does it mean? The progression and spread of the cancer into the body. Okay, and we always want to know the staging of a cancer because it decides on the therapy. If a cancer is very localized, it might just need surgery. If it's widespread and metastasized, it's going to need much more than surgery. It might need a combination of chemotherapy, radiation, hormonal therapy, all kinds of treatments. The grading, that's done by a pathologist, and it tells us how differentiated are these cells. Are they very well differentiated and not very aggressive? Or are they really strange appearing cells that look nothing like the normal cells that exist in the area, and they're poorly differentiated, meaning likely they're very aggressive. Okay, and so this is again just a slide showing you the concept of staging, right? So stage 0, very localized, early form, maybe a little cluster of cells. Stage 1, localized, hasn't spread anywhere. Stage 2, still local, but advancing into adjacent tissue. Stage 3, typically locally advanced, plus involving some lymph nodes. And stage 4, metastasized to distant areas of the body. Okay, so here's that TNM staging system of the size and extent of the main tumor, the spread to nearby lymph nodes, and has it metastasized or has it remained local, right? And each one of them gives us some detail about the staging of the cancer. I think if you just know the concept of this staging system, I don't think you need to go into significant detail, because every cancer is going to have a slightly different TNM staging system. So just knowing the concept that T stands for tumor, N is for lymph nodes to nearby lymph nodes, and M is has it metastasized or not. Okay, so what are some common symptoms of cancer in a patient? So symptoms that when we hear these symptoms, they can be very concerning for a cancer that we just haven't diagnosed yet. Okay, so, and a lot of them are dependent on the site of the initial cancer, right? So it's hard to go through all the symptoms of every cancer. So let me give you an example. If someone has lung cancer and they're losing weight and coughing up blood, hemoptysis, okay, that's a symptom of lung cancer. But every different cancer gives its own set of symptoms depending what it's causing in the area. So these are just general symptoms. So a general symptom, anorexia, lack of appetite. And actually, some people can't even look at food or smell food because it just makes them feel ill. Unexplained weight loss, right? So a patient that comes in and said, you know, I've lost 20 pounds in the past 2 months and I'm not trying to lose weight. Okay, that's concerning, right? Because cancer makes you lose weight. Unexplained fatigue and weakness can be a sign of cancer. Many cancers secrete all kinds of factors into the bloodstream that make you lose your appetite, which then causes you to lose weight, and can also make you feel fatigued and weak. But also, many cancers can make you anemic, meaning low red blood cells in the bloodstream. So weakness can be from the fact that your red blood cells are low and you're anemic. Unexplained fevers and night sweats. So I mentioned lymphomas. They classically give you night sweats. Okay. Other cancers can also give you fevers, right? Because there's an inflammatory process occurring with cancers. Anemia, I mentioned, that's the low red blood cell count or low hemoglobin, and that can be partly due to some cancers causing bleeding. Say, for example, a colon cancer in your bowel. It's just dripping blood all day that you don't necessarily see in your bloodstream, or sorry, in your stool, but it's there in a small amount every day, and you gradually become anemic, right? Anemia just means low hemoglobin in your blood. New onset pain. So someone that presents, say, with bone pain, an older person that comes in with a very painful spinal bone, or a very painful bone in the leg. We might suspect a bone cancer or a metastatic lesion to the bone. Bruising and bleeding. Well, as your bone marrow shuts down, if you have cancer that has spread to your bone marrow, or you have cancer in your bone marrow, well, you're going to become anemic, so you're going to look pale, you're going to be weak, so that's from low hemoglobin. What about low white blood cells? Well, you're going to be prone to infections because of your low white blood cells. And what about if your platelets aren't being produced? Well, you're going to have bruising of the skin, bleeding of the gums, because platelets are responsible to help blood vessels clot, right? A new cough with blood, that would definitely be concerning for a lung cancer, right? Rectal bleeding. So someone who comes in with, say, anorexia, weight loss, fatigue, and rectal bleeding, that would be concerning for a colon cancer. Okay, so these are just examples of some of the symptoms that can occur with cancers. Okay, so let's go over some screening tests for detecting cancer at an early stage. And when we use the term screening, what we're really talking about is testing large portions of the population that don't have any symptoms, right? So we're screening them to try and pick up an early cancer, since the feeling is that the earlier you detect a cancer, the more likely there'll be a positive outcome and reduced death rate. Okay, so let's look at a couple of them. So there's a blood test called PSA, prostate specific antigen. This chemical is produced in the prostate gland naturally, but as it goes up in the bloodstream, it can indicate a prostate cancer is forming, and it's causing increased PSA levels in the bloodstream. So you'll likely hear about this test when you're working. You'll see patients going for it because in your 50s and 60s as a male, it's not an uncommon test to go and have as a screening test. If it's elevated, does it mean 100% that you have prostate cancer? Definitely not. But it can be an indicator that the patient needs further testing to clarify why the PSA is elevated, okay? And that usually involves taking biopsies of the prostate gland to determine if there's prostate cancer. Okay, what about a pap test or a pap smear? Well, this test has been around for decades. It's very effective, okay? So a very, very good screening test. And the process is to take a sampling, typically just with a brush now, where we'll take a sampling of the cervix and the cervical canal of cells, and then send them to pathology to be looked at under the microscope to see if there's any evidence of dysplastic cells or cancerous cells. Okay? And remember, cancer is often a spectrum that starts with dysplasia. So if we can pick up dysplastic cells first, then we can actually prevent cancer from occurring in certain patients. Okay? A mammogram for breast cancer, which is recommended for women at least until the age of 72. Some places go longer. And basically it's an x-ray of the breast, right? And they're looking for specific changes in the tissue, such as calcifications within the breast tissue, that can indicate a cancer is forming. Okay, it's not a super accurate test for breast cancer, but in combination with self breast exams, um, it can pick up cancers. Colonoscopy for screening of colon cancer, which is usually recommended at the age of 50. So we're talking about tests where there's really no symptoms, you're just going for a screening test. And a colonoscopy is basically a video camera of your entire colon. So yes, the preparation for a colonoscopy isn't fantastic because you have to completely purge yourself of all stool so that they can see the wall of the colon. But it's a fantastic test, right? It'll pick up polyps, it'll pick up precancerous lesions, and definitely it'll pick up colon cancer because they'll take samples of concerning sites. Annual mole checks or frequent mole checks by the patient is important to try and pick up malignant melanoma. So a patient that has multiple moles, typically they'll go and have those moles checked. Clinics will often take photographs of the moles and keep them on file. And if there's any concerning changes throughout the year, such as irregular shapes, bleeding, multiple colors in the melanoma, increasing size of the melanoma, the patient can go back and have the lesion checked. Okay.